Okay, so here we go. We have a punch biopsy, and this lady had red, kind of violaceous papules all over her skin. And one of the dermatologists were called to look at it, and I won't tell you what they thought that it was because they were totally right. But I'll tell you that the internal medicine team saw it, and they thought it was going to be vasculitis. They thought it looked kind of like vasculitis clinically, which I think is understandable. So here's a punch biopsy, and what we have here in the middle is a hair follicle, right? So we are kind of almost a little collection of maybe 2 or 3 hair follicles near each other. And when we zoom in closer on that hair follicle, look what we can see is a cross section of the hair shaft, but not just one. 1, 2, 3, 4, 5. It's like a little multiple cross sections of a hair shaft with this dilated follicular opening. So what that implies to me is that the hair is kind of curling or twisting around a little bit, and we're getting multiple cuts through this twisted up kind of spiral shaped hair. And then in the dermis here, next to the hair follicle, we have red blood cells, erythrocyte extravasation. Lots of blood. Look at all that blood. Now sometimes it's hard when you see blood microscopically in the skin to know, is this blood real? And I put air quotes around real. Is this real, meaning is this an in vivo hemorrhage, like in the patient? Or is this blood that just spilled artifactually when the biopsy was performed? Of course, the blood is real. The erythrocytes are real. But is this blood actually present in the skin while it's in the patient? Or did this just spill out artifactually from the biopsy procedure? And one thing that can help is the clinical. If it looked violaceous or erythematous, looked red, looked like there would be blood in the dermis clinically, then it very well may be real blood, real hemorrhage. If you find hemosiderin with the hemorrhage, that's another sign that it could be actual in vivo hemorrhage, although you don't get that with acute hemorrhage, right? That's only with hemorrhage that's been there for a while. It's what happens when you get an ecchymosis, a bruise. The other thing is that this pattern to me of erythrocytes scattered and trickled in the superficial dermis especially, usually to me when I see that pattern of blood evenly kind of scattered throughout the collagen, or in this case the solar elastosis, because this patient was a little older and had sun damage, that usually to me is usually a pattern that you see with true in vivo hemorrhage. Okay, so this is perifollicular hemorrhage and a spiral shaped corkscrew hair. So if you're not into dermpath, you might be like, yeah, okay, so what's the big deal? But those two things are buzzwords for a relatively uncommon condition, or at least nowadays it's pretty rare to see in the United States. But in the old days, it used to be actually quite common. So this corkscrew spiral-shaped hair and perifollicular hemorrhage, I will show you the pictures now. And this part I may have to edit out because YouTube won't like this. This was the pictures from our patient, and there was hemorrhage and swelling of the gums, the gingiva, perifollicular hemorrhage, particularly on the legs, the arms also. You can see these twisty, spirally, kinked corkscrew hairs here, and then my former resident, Malin Kern, did a perfect biopsy right into the right around one of these hairs, and we got lucky that we got a perfect cut right through the middle to see this. So all these features together, this is characteristic of scurvy. So this is scurvy, and we, Malin and I, published this in the New England Journal of Medicine, which is the only thing I'll ever get published in the New England Journal in my whole career. I am certain of that. And it was really all about the pictures. We put 4 pictures, and like it was just a little single small paragraph. It was just an example of a classic clinical and path presentation of scurvy. And so this patient, they tested the vitamin C level in the blood, and it was close to 0. It was extremely low. The patient had reduced oral intake because of some esophageal problems, and they had been basically, I think, having a very limited diet for a long time that did not include vitamin C. So in the old days of wooden ships and in the days of sail, this was a much bigger problem because people didn't have access to vitamin C, and scurvy occurred. Nowadays, it's really quite rare, and I used to say, well, this is the only case of scurvy I've seen, but I've actually seen a couple of cases since this, none quite so perfect as this case here. The one thing I will point out, where did my, oh there, it just needed refreshed a little bit. The one thing I will point out, that scurvy classically has the corkscrew hairs and perifollicular hemorrhage, but not always. So I saw a case after this where a patient presented with painful, firm, indurated, like calf. Their lower leg was painful, and it was so painful as a teenager. The patient was basically like refusing to walk because it hurt so much. On imaging, there was some thickening and swelling of the muscle and the fascia, but they really couldn't figure out what was going on. And on the skin, there was no skin discoloration, no hemorrhage or anything like that. A biopsy was done, and they were concerned it might be eosinophilic fasciitis, which is something that's probably closely related to morphia or localized scleroderma, but involving the fascia and the fat, or at least I think of eosinophilic fasciitis as something like that. But microscopically, all I saw was hemorrhage around the fascia, nothing that looked like scleroderma or morphia or eosinophilic fasciitis. So it turned out, thankfully, the resident had, the dermatology resident had taken a photo, and even though there was no violaceous discoloration of the skin, there were twisted corkscrew-shaped hairs. And I said, you know, I wonder if this could be scurvy. And sure enough, one of my colleagues did some searching in the literature and found there have been a few reported cases where scurvy presented with deep hemorrhage, which was really painful, and it caused induration and mimicked eosinophilic fasciitis. And this child was autistic and had very restricted oral intake, only ate like French fries and chicken nuggets or something to that effect, and basically had no fruit and vegetable intake. And they checked the blood of the patient, and the vitamin C was close to 0. So that case was really amazing to me because the hemorrhage was so nonspecific microscopically. It wasn't this classic perifollicular hemorrhage. It was deep hemorrhage. And they didn't have the typical presentation. And the reason I want to bring this up is in case anyone's watching this online, just to know that this is an alternative, unusual presentation of scurvy. And it was only if the dermatology resident would not have taken that photo, I would not have thought of it. The clinical photos sometimes save the day in dermatology. And also another case of scurvy, I'd seen a patient had known scurvy, and they had a muscle biopsy for some reason, and there was just hemorrhage in the muscle. And a colleague showed me that, and I thought, kind of boring microscopically, but that's interesting. It makes sense that they have hemorrhage since they have scurvy. So I had seen that case a year previously, and then the dermatologist had taken a picture, and I got to see the corkscrew hair. And because of that, and my kind of interest in scurvy from this one case report, all the pieces came together, and we got to make the diagnosis. And I thought those are those kind of moments where like good medicine happens, and it wouldn't have happened if it weren't for all of the people doing all of the right things and all the pieces coming together. So that's a great example of like how teamwork is really where it's at. All right, scurvy. So be on the lookout for it. I will say I do sometimes see hemorrhage next to hair follicles, completely coincidentally, that are clearly not scurvy clinically. I also sometimes see kind of twisted spiral-shaped hairs, and I like to joke about it with my residents. Oh, look, it's going to be scurvy, and it's, you know, like a melanoma excision or something where it's just an incidental finding. But do remember that scurvy is out there, and especially because there are, you know, fad diets. There are people that have low oral intake either for neurodivergent reasons or because they have a esophageal problem or had surgery. So there are a variety of reasons that people, even in developed nations, can sometimes be deficient in vitamin C or other vitamins and nutrients. So keeping vitamin deficiencies and things in mind is important, because if they're not diagnosed, they don't get better, and they're usually actually quite easy to treat for many of these things. You just give them the missing vitamin. All right, so that was scurvy. There was our New England Journal citation, and I'm still waiting for the Nobel Committee to call us. Probably won't happen, but it was a pretty cool case. Any questions about that? All right.